Hello and welcome to Health and Wellbeing on ASO Radio and Television. I am Lois Abasambo. Since the outbreak of the coronavirus in China in 2019, more than 230 million people worldwide have contracted the virus, with more getting infected daily. The virus is rapidly spreading with human-to-human transmission due to the increasing number of variants that are emerging. Now, due to this, experts say we may have to live with the virus for a long time. However, various researches are ongoing to find out more about the virus and how to tackle it. Well, today on Health and Wellbeing, we shall be discussing COVID-19 from the radiologist perspective. Our guest today is Dr. Aliyu Oyegbamiji Akanwo, who is a Chief Consultant Radiologist with Crescent Radiology Limited. Dr. Akanwo, you're welcome to Health and Wellbeing.
Thank you.
And
Good
it's
afternoon.
nice having you here.
It's a pleasure.
Well, we're going to go on a short break, and when we return, our discussion will commence. Do stay with us.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803-705-1784, or Dr. Doris John, 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
I'll send it. Okay. Welcome back, and thank you for staying with us. Before we went on the break, I told you we're going to discuss COVID-19 from the radiologist perspective, and I told you that Dr. Aliyu Akanwo is here with us to discuss this. So from the radiologist perspective, when we talk about radiology, we know it has to do with scanning. Yes. And firstly, I would like to understand what's the difference between COVID-19 and pneumonia, and even the flu. You know, because it seems like they're almost in the same family. It has to do with the flu, it has to do with the lungs. So what are the distinctions between COVID-19, pneumonia, and even the flu?
Thank you, Lois. Let me correct something. That radiology has to do with scan. Actually, radiology started with X-ray. Taking of X-ray, chest X-ray, I'm sure you are familiar with that. So X-ray, scanning, treatment, and so on and so forth. Majority of them come under radiology. That's number one. Then, to answer your question, the relationship between
pneumonia
and COVID-19.
Yes.
Pneumonia is a general term due to infection of the lungs. This infection could be due to bacteria, could be due to viral, could be due to fungus. COVID-19 is a virus. But when somebody has pneumonia in the lung, what it means is that when a droplet is inhaled by the individual, droplets are substances that come from the way we talk, when we sneeze, when we cough, when we laugh, anything that comes from our mouth or nostrils. These are droplets. We cannot see them. So from an infected person, then another person catches it. When it gets into that person, into the respiratory system, then it may go into the lung proper. When it gets there, especially in the small airways where air is exchanged, at that level, it can cause destruction of that small airway. Also, that's the disease causing that problem. The response of the body to that disease, which we call inflammatory process, can also lead to a lot of damage because a lot of water will move there, a lot of micro substances from the body defense system will move there. All that will cause more water in that space, and they will cause destruction of that airspace. That is pneumonia. Now, I said it can be caused by virus, by bacteria, and by fungus. So in terms of the difference, there is no difference in the pneumonia caused by any of them because the process is the same. All right? Yeah. But of course, there are a lot of differences between this particular terrible virus, COVID-19, and bacteria, and other viruses, and fungus. There's a lot of differences. One, instead of causing pneumonia on one side of the lung, everybody has two lungs, on the right and on the left. Instead of causing pneumonia on just one side, it causes pneumonia on both sides. That's one. Number two, the damage that it causes is far, far more pronounced than simple bacterial pneumonia. Okay? And number three, it causes other complications, you know, and it is actually those complications that affect, that put the person that is infected into trouble. Because when you institute normal process of treating the pneumonia, the complications are there. And so until some researches were done and these complications were identified, that's when the treatment of COVID become more manageable. You will remember that initially when it started in December 2019, early 2020, it was killing people. Like, very terrible. But today, the management has been much better, you know. So these are the differences.
So is it safe to say COVID is like an advanced version of pneumonia?
No, I wouldn't use the word advanced. It's just the normal, natural behavior of the COVID. It's not that it is advanced. You know, that is why I defined pneumonia earlier and then tell you what COVID does. Now, pneumonia is pneumonia. So for COVID, it doesn't cause any advanced pneumonia as such, you know, but the complication is dramatic. Yeah.
So, you know, the COVID-19 is rapidly spreading. At a point, we felt like we had it under control, you know, and then we started seeing different variants, and wow, we were all over the place trying to find out what was happening. Now, the most dangerous variant as of now is the Delta variant. What makes it so dangerous?
The Delta variant is dangerous for a number of reasons. Number one, first of all, virus, unlike bacteria too do it, but virus in particular, they mutate. Mutation means changing from one form to another, from one variant to another variant. And they do it so rapidly. They can do it many times in a day. Bacteria takes a long time to do it, especially when you are given a particular antibiotics and is used to it. They say, no, I know you, I won't respond to you again. That's bacteria. Virus, whether you give antibiotics or whatever, or any treatment, it is their nature to mutate. That's one. So, to answer your question, it is different and it is deadly because the way it presents is different from the original COVID virus. Now, the original one will settle in the nostril and in the throat, and it will give the person who is infected discomfort. This one doesn't. This variant does not do that.
Oh, that is really deadly. So you don't even get to have symptoms.
No, you don't know that you have it. And it doesn't settle in the upper there. It goes directly into the lungs. that place where I was describing that it can be destroyed quickly, it goes right there, and you wouldn't know. So, some people will have headache, feeling unwell, and you think, well, it's malaria, let me just go to the pharmacy,
Get an
anti-malaria, and something like that. Meanwhile, it's dealing with him. And the way it destroys, in fact, some people describe it as if it's destroying the lung, is making the lungs to be rotten. Can you imagine? Rotten, live person is getting rotten inside, unknowing. It's terrible, it's deadly, and we have to be very careful.
We have to be. We have to be. People have to actually be made aware to understand the gravity, because, so many times there are so many jingles. In fact, the media space is filled with jingles about the Delta variant is here and is more deadly, but people don't understand how deadly it is.
In fact, if I may come in here, I'm thinking we'll speak about that later, but we can say it here. Our behavior has a lot to be desired. We have to accept that COVID is here. We have to take the precaution. We have to take the treatment. Well, it's not treatment, it's precaution also. All the basic non-pharmaceutical precaution, very simple thing to do. Wear your mask, physical distancing. If you touch a surface, wash your hand properly, or use sanitizer, and so on and so forth. And there are reasons for this. There are basis for this. Very simple thing. And if we do it, I tell you, this thing will go. If we don't, we're going to live with it. We're going to have many more variants coming. We are lucky now that the vaccines that have been developed are effective against the Delta variants. Who knows what will happen tomorrow? If we have, there are other variants after Delta already.
Yes.
Yeah, but they are not so troublesome now. We are lucky. So, but who knows what will happen tomorrow? So we need to take these things seriously. It is better, I know it's not so comfortable wearing mask, but it's better we suffer that little discomfort than for somebody to go and land in the hospital with the ventilator. The ventilator does not even work.
When there are no lungs, It
doesn't work when the alveolus are destroyed. Those things that I was explaining earlier, they are destroyed. There are other complications like thrombosis that are formed in the lung. They don't allow the exchange of air between the blood and the air that we breathe in. They don't allow it to happen. How can anybody breathe with that? And it's a very simple thing. I'm telling you, it's very simple to control if we change our attitude.
Now, that's a long way. And I'd also like us to talk about, now talking about COVID-19 from the radiologist's perspective. So you see how you explained it to us that the lung is getting rotten. And that's basically from what you were saying, x-rays and scans and being able to see. But we'll discuss that after when we come back from this short break. I'd like you to break it down for us, what radiologists have been able to find out and how they can explain it to us in layman's terms so that we understand the extent of this virus and how and why there is a need for us to actually take this serious. Now, our discussion is going to continue when we come back from this short break. Do stay with us.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers. Dr. Sadiq Abdurrahman, 0803 705 1784, or Dr. Doris John, 0803 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled, and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Welcome back, and thank you for staying with us. And I've been here with Dr. Akao, who is telling us more about COVID-19 from the radiologist perspective. And before we went on the break, I said we're going to talk about it. COVID-19 from the radiologist perspective, how scans, how x-rays have revealed the extent to how COVID-19 is actually ravaging. I'd like you to tell us more about this.
Okay, thank you. To understand this, we need to know the role that radiology play and radiologists play in the management of a patient in an hospital setting. When a patient has problem, when a patient is sick, the first step to making the person get well back is to know what is wrong with him, to make a diagnosis. This is where radiology plays a major role. Up to 70-90% of people who come to the hospital, they will pass through radiology department for one test or the other. This is to make an intelligible sense of what is wrong with the patient. Now, with regard to the COVID, radiology has played a major role, very important role, because the problem was thought to be affecting lung primarily. Yes, that's the major organ that is affected, but it affects all organs of the body from the head to toe. Now, let's concentrate on the lungs. A number of studies, a number of researches has been done, both abroad and in Nigeria, that has tried to study what are the features, what are the patterns of the pathology, that is the problems that the thing caused in the lung. And some of them have been established. For instance, I said it affects the two lungs instead of one. That is very important because human beings have two lungs, not three lungs, not four lungs. If it is one lung that is affected, then you have another one.
Backup. Yes.
Now, it affects the two lungs. So radiology has been able to determine this. You understand? How does it affect the lung? It causes shadows, what we call shadows in the lung. How do I explain it in layman's language? Ground glass appearance, that's the language that we use to call it. Meaning, it's like a dew. You know, that morning dew that you see, you know, especially during the wet season. You get it?
Yes.
That morning dew. You will see, you may not be able to see my sisters sitting down there. If there's a dew here between us, ground glass appearance. That's what it starts with. And it affects the lungs in the periphery of the lungs and in the basis. It is the radiology that has described this pattern, not any other medical system. And then, in the advanced stages, where there is complication, you can find emboli in the blood vessels in the lung. And this is the terrible killer part of the disease. Emboli. When somebody has pulmonary embolus, it's almost there.
So let's break it down for us to understand as lay people. Yes.
The embolus is like blood clot.
Okay.
In fact, it's not like.
It is.
It is blood clot. In the airway, in the vessels that carry oxygen to the lung, to exchange it to the tissue that makes you and me to breathe. These vessels are blocked by clot of blood. We know clot of blood?
Yes.
By clot of blood. So that oxygenation exchange cannot take place. No matter how many drums of oxygen you are trying to give the person through ventilator, it cannot happen. And that's what kills most people who die. Yeah.
Well, that's dangerous. Now, is this just or how do I want to put it now? For the Delta variant now, let's concentrate on how fast is that? Because one of the things they say about the Delta variant is it's highly transmissible.
Yes, yes. I forgot to mention that it's highly transmissible. It's easily transmissible. It's innocuous. You won't know it is there. You know, and then it causes more damage than the previous variants. Within 1 minute, 10 minutes, the damage that it will cause will be far, far more than the previous variants. So this is why it is very deadly. And this is why people die from it more than the previous one. The good thing today is that all the vaccines that have been provided, they are capable of attacking these variants. So people who have taken this vaccine are not as badly affected as those who have not taken it. The literature has shown that the people, if 10 people come with the variant to the hospital, complaining that I'm feeling sick or something like that, when they examine them, well, this one needs admission, that one needs admission, this one does not need admission. Those who do not need admission are those who have taken the vaccine. Majority of those who need admission are those who did not take vaccine at all. Majority of those who die among those people are also those who don't take vaccine. So what are we waiting for?
Quite a number of conspiracies, but I don't want us to go into that. But I believe, like, with so many researches and things that are being found out, you should be able to convince us, you know, like, even though people say, yes, like you said, most, and I think that's the word that people should actually take on. Most people, even though there are cases where, even though the people that have been vaccinated have gotten down with COVID, some have even died. But people always want to capitalize on that, you know, on the fact that this person took the vaccine and this person still died. So what's the point?
Now let's talk about that. It's very important. It's very important because I think we should seek knowledge. That's where we should begin. When you hear something or you are told something, check it out. Check the knowledge wherever that knowledge is. Everybody can check knowledge, can find knowledge. That's number one. When you have knowledge, you'll be free. You will understand and you will be able to think through. They said this, how does it make sense? They said this, how does it make sense? You know. Now, coming to people taking vaccine and dying. Yes, it happens. Number one, taking vaccine does not mean that you will not have the disease or you will not be infected. But if you have the vaccine and you are infected, the severity of the disease will be minimized. Why do we give our children polio vaccine, BCG for TB, you know, diphtheria vaccines, and so on and so forth? It is not to say that they will not have disease. It is to prevent them from having serious disease when they have that disease. Do you understand?
Yes.
That's how vaccine works. Vaccine does not prevent having disease. It prevents having seriousness of the disease. Do you understand? So now, for somebody who has taken vaccine and has disease, that person has a chance of surviving. If he does not survive, let's check it out. Does he have some other underlying conditions? So these are the questions that people should ask. This person who took vaccine and died, what was his normal, natural health status before? We should find it out.
True.
What are the other things that are associated with this death? Is it just the COVID, or there are some other things? These are the questions.
Well, people actually truly need to understand that vaccines are not foolproof, but it actually gives us a certain, you know, an upper hand in one way or the other, and that doesn't mean we should just go about doing anything anyhow. Anyways,
if I'm not going to waste time, even diseases that are not infective, hypertension, diabetes, why do you take medicine against them?
True.
Does it remove those diseases?
It doesn't. It doesn't. It just suppresses.
It suppresses it. And then you live your normal life every day. You achieve whatever you want to achieve in life.
So going on now, the Association of Radiologists in Nigeria held its fourth annual general meeting, and basically that should be talking about groundbreaking discoveries and what radiologists have been able to find, in most especially in relations to COVID-19. I'd like you to tell us more about that.
Okay, thank you very much. As you know, Association of Radiologists of Nigeria, which is, as the name implies, a collection of the radiologists practicing in Nigeria. It's a very important association. Our annual conference that we just did last week was to showcase what we have been learning, or what we have been gaining, what we have been doing research upon, and so on and so forth. And we have actually progressed, we have improved in terms of what we are doing. Because, and the other reason why we organize conferences is to exchange this knowledge, and then to advise one another as to the way to go, advise government, advise everybody that has to take part in making sure that the health of the community is top-notch. That is one thing that we achieve with that conference. Now, COVID-19 is an emerging disease. It's still emerging. We are still studying this. We are still studying it because the virus is still mutating, causing more variants. You understand? So, ARIN is taking bold steps in that regard. We have collaboration amongst ourselves inside Nigeria and outside Nigeria, because this conference showcased people who came from abroad to give lectures, to give information about their researches and the progress that they are making. Those who could not come, talk to us by online, by Zoom. Okay? Now, so we are still studying this problem, and we are making progress. It is part of the study that I said within Nigeria that we discover the pattern of the changes in the lung. For instance, I know of 3 studies in Abuja alone. University of Abuja by, I don't know whether I can...
Yes, you can.
Yeah. By Professor Nze and Dr. I will remember the name later, And then another one by Dr. Salau at Cedar Crest. And then Dr. Jima and Dr. Daji in National Hospital. Because the problem provided the opportunity for us to study people that have that disease. And we took advantage of that, and we are studying them. And that is why we have the result. What they got in the research that is not different from what is reported abroad, So, and those studies have been published, and we're happy about that.
Well, thank you very much, Dr. Akanwu, for taking our time to be here with us on Health and Wellbeing. We sincerely appreciate your presence, and we hope that next time when we call, you still take our time to be here with us.
Thank you for having me.
Oh, thank you very much.
Yeah, thank you.
Well, that's how far we can go on health and well-being today. Do remember that the COVID-19 Delta variant is still ravaging and very dangerous, and we all have to take responsibility for ourselves, our loved ones, and everyone. Do keep it a date with us, same time next week. I am Lois Apasambo. Do stay safe.